this graph looks at the patients who met criteria for having at least one of these three conditions: obesity or overweight, hypertension, or depression. So what we found over 188,000 patients meeting these criteria. 54% of them have only one of these conditions, and 46% have at least two of those conditions, with 10% have all three of these conditions. Is this a problem with just older people? No. Majority of the patients, these MCC patients, are younger than 65. We have a problem with problem recognition among patients with these, those who are meeting criteria. So based on AHRQ data, 31% of them who are overweight had a diagnosis. 54% of the patients who was BMI or obese had a diagnosis, and for those patients with high blood pressure measures, 47% of them had a diagnosis. Any treatment for hypertension, if they have all three conditions, including overweight, hypertension, or depression, only 54% of them had any treatment. But having obesity and hypertension, or obesity, hypertension, and depression increases the probability of getting any treatment. The other treatments for overweight and obesity, so out of 32,000 patients in the cohort of 2002 that started that, we had observation data on them, 500 of them attended health education classes on weight management. There's all kinds of weight management classes, but 500 of them attended. 561 of them received bariatric surgery. And doing multi-level linear growth curve modeling, we see this is the trajectory of BMI over time. What we see here is those patients started initially in the 2002 cohort again, overweight. With overweight and depression, their rate of increase in BMI is the fastest. And this, oh, okay, I'm not.